If you have been diagnosed with hepatitis C, you join thousands of other Australians who have the virus. Hepatitis C may affect your daily quality of life and can cause long-term damage to your liver. The good news is that treatment is available in many cases. If you are infected with hepatitis C, you need to find out whether treatment is suitable for you. In this presentation, we'll explain more about hepatitis C and its treatment.
I'm Dr. Miriam Levy. I'm a liver specialist and I treat patients with hepatitis C. I'd like to talk to you today about some of the issues that are important for you to understand. This is not meant to replace a visit to your specialist. It should help prepare you for your consultation and help you weigh up the options by understanding more about the disease and treatment.
My GP has told me I have hepatitis C, but I'm not even sure what it is. I guess they'll explain it to me in the morning.
The first thing to understand is a little about what hepatitis C infection does to the body over time. Hepatitis C, or HCV as it is called, is a virus that causes inflammation of the liver. After many years of inflammation, the liver can become scarred. In most cases, hepatitis C does not cause any symptoms. Many people are diagnosed when they have a checkup for some other reason. The family doctor may check liver function tests and notice that they're not normal. Follow-up tests then show hepatitis C infection is the reason the tests are abnormal.
So have you had any tiredness or any other symptoms, Bill?
Tiredness, but it's only the new baby. None of us are getting much sleep.
Some people do complain of general symptoms such as tiredness, aches and pains. We all feel these symptoms from time to time, so it can be hard to know if hepatitis C is to blame. Symptoms certainly develop in the later stages of HCV if the liver becomes very damaged and scarred. When this occurs, we call it cirrhosis. Symptoms from HCV can improve with treatment when the symptoms are due to the hepatitis C infection. How did you get the hepatitis C infection? Hepatitis C is caused from blood-to-blood contact. Often this occurs when equipment is shared during injecting drug use. You may have been infected with hepatitis C as a result of blood transfusion in Australia prior to 1991 or from non-sterile tattooing. Sometimes no cause can be identified, particularly in migrants. It may have been spread by the use of non-sterile equipment during a medical operation or injection, such as simple vaccinations in your country of birth, or from shaving razors. The main reason we try and determine the cause of the infection is so we can estimate how long you've had hepatitis C. We can get some idea of the risk of liver damage from the length of time you've had the infection.
What does the liver do, and how is it affected by hepatitis C?
The liver is the largest organ in the body and acts as a filter to remove toxins and waste products from the blood. It makes important proteins for the body and helps in digestion of food and stores vital nutrients the body needs. The hepatitis C virus attacks the liver cells and this causes inflammation. Over a long period, this damaged liver can become scarred. There are different stages of liver damage, but when the scarring becomes widespread and severe, we call this cirrhosis of the liver. While this sounds bad, even with liver cirrhosis, the liver may function perfectly normally for a long time. But in late stages of liver cirrhosis, the liver function will begin to fail. Liver cirrhosis can lead to problems such as bleeding, jaundice, that is turning yellow, swollen ankles or a swollen abdomen, or even confusion. Scarring can affect the shape of the liver, which can also affect its function. For example, if blood does not flow normally through the liver, pressure can build up and this can result in bleeding from the gullet. Some people with liver cirrhosis may develop liver cancer. Overall, 20% of people with hepatitis C infection can develop liver cirrhosis after 20 or 30 years. Remember, this means that the majority of people with hepatitis C will not develop cirrhosis. They will live a normal lifespan and without a blood test may never have known that they have the infection. Your doctor may try and help you predict how likely it is that you will get cirrhosis, but this is not always easy.
What treatment is available for hepatitis C, and does it work?
Understandably, most people would like to get rid of hepatitis C once they know they have it. If there was a simple tablet which cleared the infection with great success and without side effects, we would treat everyone. Unfortunately, this is not the case. The two major problems with hepatitis C treatment are the side effects from therapy can be quite bad and that the therapy will not always work. I will try and use this discussion to help you identify the chance that hepatitis C treatment will work for you and also the chance that you will be able to tolerate treatment side effects. Let me give you some information about treatment. Basically, treatment is like a mild form of chemotherapy. Patients undergoing treatment will require 6 to 12 months of treatment with pegylated interferon, which is an injection once a week, and ribavirin in the form of tablets taken twice a day. The medical term sustained virological response means the virus has gone not only whilst you are taking therapy, but even after therapy stops. We test for a sustained virological response 6 months after completing treatment, and only then will we know if the treatment has been successful. If you take the therapy as prescribed and can manage to take the full dose, then the chance of a sustained virological response, that is, permanently getting rid of the infection, is about 50 to 80% chance.
How will the side effects of the treatment affect me?
Let me tell you about the side effects of treatment. The initial side effect is flu-like symptoms, aches and pains, and sometimes temperatures. These symptoms are particularly bad in the first month or two and usually settle down. A general tiredness often continues. Let's talk about whether this might be a good time for treatment. Can you tell me a little bit about your home life?
We're pretty stretched at the moment. The wife's looking after the new baby. I've taken a double shift. We're all pretty tired looking after the baby and the rest of the family.
Some people are unable to continue their normal activities and are unable to work at their normal level. It's very difficult to predict who will suffer badly with side effects. Some are surprisingly unaffected. It is important to think about your current life and consider whether you have the supports you need. Your family, clinic nurse, family doctor, social worker, psychiatrist or drug and alcohol team can be really important to help you through treatment. For example, if you have young babies or no sick leave at work, or you've just started a new job, you may want to reconsider whether treatment is right for you at this time. Your mood and emotions can sometimes be severely affected by treatment. We worry a lot about the chance of developing depression because suicide has occurred as a direct result of interferon treatment, and this tragedy must be avoided. Psychiatric problems in the past may predispose you to depression, but they can occur for the first time during treatment. It is important to address any emotional or psychiatric problems you currently have before starting treatment.
So how's it been going for you?
Up and down. Worse after the injections. I find I get pretty moody.
Moody?
Yeah, is that a normal thing to experience? The mood swings are pretty full on. Just been experiencing a lot of, irritability and it can be a bit annoying at times.
Anger can also be a problem. Some patients develop anger rather than depression. Because of the sometimes severe and unpredictable effects on mood, most hepatitis clinics offer good support by nursing staff, social workers and psychiatrists to identify serious mood disorders and respond early. This can be hard to manage, especially for family and work colleagues, and needs to be anticipated and monitored.
The blood count can also be affected. Anemia may develop, which makes tiredness worse and can cause serious problems if you have underlying heart or lung disease. The white cell count can also fall sometimes. White cells are needed to fight infection. One of the drugs, ribavirin, may harm an unborn baby It would be inappropriate to take these drugs if you're planning to have children soon. It's critical that birth control is used during treatment and for 6 months thereafter. This means that you need to use birth control to avoid accidental pregnancies during treatment. The withdrawal method is not satisfactory. If you wish to fall pregnant, it is safe to do so 6 months after the completion of treatment. Interferon stimulates the immune system. Sometimes this leads to skin rashes, eye problems, thyroid problems. These need to be monitored carefully. It's important to recognise that when having such treatment, there is a chance of other rare side effects too. Problems unrelated to treatment can also occur. Don't forget to consult your family doctor if you're not sure. Even with the best care, approximately 10% of patients can't complete the therapy due to the side effects and have to abandon treatment.
What is the chance I'll be cured if I take the treatment?
Now you've heard about the side effects of treatment, let me tell you about the chance it will work. The best predictor of this is the hepatitis C genotype or strain of hepatitis you have. Some strains are very responsive to treatment. For example, if you have genotype 2, then I would say you only need 6 months of therapy and you would have approximately 80 or 90% chance that the therapy will be successful. If on the other hand you have genotype 1, which is the most common genotype, then you would need 12 months of treatment and only have a 50% chance of getting rid of the infection. It's important to be clear about the chance of success before you embark on therapy to avoid disappointment. Discuss your genotype with your doctor. We now have some markers that we use during treatment to help us see how the treatment is going. At 4 weeks, if the virus is responding well, that's a very good sign that it's going to work. At 3 months, if the virus is still not responding, then it's very unlikely that it's going on for a year will be effective, and you may be advised to stop treatment then. If you're still positive at 6 months, it is certainly not worth continuing. Some respond to treatment while you are on it, but when treatment has finished, the infection comes back. This is very disappointing. You need to be mentally prepared for the possibility that the treatment will not work. I always say, hope for the best, but prepare for the worst. So how should you decide if you should have treatment? We used to do a liver biopsy so we could see if there was a lot of liver damage, and we only recommended treatment if there was. But many people don't want a liver biopsy, and we no longer require a liver biopsy for hepatitis C therapy funded by the government. There are other ways we can check whether you have significant liver damage. Your blood tests and physical examination, as well as an ultrasound, can identify patients with advanced liver disease. More recently, at some centres we use a FibroScan machine to estimate liver fibrosis. This is a pain-free test, a little like an ultrasound, which can detect severe fibrosis or scarring and cirrhosis, not obvious on a normal ultrasound or blood test. Remember, it is important to realise that even if you do not have any liver damage at the moment, no one can guarantee that you will not have liver damage in the future. Also, remember there are other ways you can protect your liver and your health. Keep a healthy weight, maintain good exercise and a healthy diet. Avoid drinking too much alcohol. 1 or 2 alcoholic drinks a couple of times a week, I think is okay. If you do this, your chance of liver injury should be less. You should also consider whether hepatitis C is your biggest problem. If you're a heavy smoker, it may be more important for you to consider stopping smoking than starting hepatitis C therapy, as lung disease and heart disease may be a bigger threat to your health. You don't have many symptoms of hepatitis C, and the results of your FibroScan and other tests show that your liver is in good health. You do have genotype 2. There's a very high chance that you will respond to treatment.
I've talked to my wife about the treatment. We've decided now was not the right time. Maybe in a few years' time, when the kids get a bit older, she gets back to work and we'll be able to cope with it better.
If you decide not to undergo treatment now, you can review your decision at any time in the future. In the next few years, there will be newer and more effective therapies than the ones we have now for hepatitis C, hopefully by 2012. These drugs are in the research stage and the early results are very promising. This is especially worth considering if you've very mild disease or a hard to treat strain of infection, or if you have had treatment before and it was unsuccessful. In summary, if you are interested in hepatitis C treatment, you need to think about the following: how likely it is to work, whether you are likely to tolerate it, what are your reasons for wanting treatment, and what will happen if you decide you don't want treatment. This information is intended to help you when you discuss the possibility of treatment with your specialist.
Part 2 of the program outlines what to expect once your specialist recommends that you're suitable for treatment and you decide to go ahead with it. At this stage of your treatment, you'll be dealing with the clinical staff at the hospital as well as the specialist doctors.
Hello again. In part 2 of the program, we will be explaining what your treatment involves. We will discuss side effects and some strategies for dealing with these. I have with me Louise Smith. Louise is a clinical nurse consultant in the Department of Gastroenterology, and she will take you through part 2, treating hepatitis.
The first thing you need to consider if you are eligible for hepatitis C treatment is the cost. Often there is not much cost associated with treatment if it is being largely covered by Medicare.
Hi, how are you?
Good, thank you. I'm here to see the doctor.
Can I have your Medicare
Medicare,
card?
which is Australia's health insurance system, pays for all or part of the cost of a visit to a hospital, doctor or specialist. Medicare pays part of the cost of other tests and services, so you make sure you bring your Medicare card.
Would you please sign for me here? Thank you.
If a doctor bulk bills, that means the doctor's visit won't cost you anything.
Thanks a lot.
If your doctor does not bulk bill, you pay the doctor yourself and claim some of the money back from Medicare. In Australia, the cost of medication is free for most people, though there is a fee for the pharmacist or chemist to provide it to you. You will need to attend regular visits to the hepatitis clinic, who will monitor your progress and check for side effects. If you don't speak English and the doctor does not speak your language, ask the clinic to arrange for a professional interpreter. When you visit for the first time, we will ask for details of your medical history, what allergies you might have, and what medicines you might be taking.
Hi Susie, how are you today?
Not bad. What's happening today?
We're going to take a blood test. We're going to talk about the side effects you've been having.
Okay, great, because there was a few questions that I wanted to ask you about that actually.
Each visit will involve a review from the clinic nurse or doctor, blood tests and monthly restocking of your medications from the pharmacy. Some people may need more frequent visits to monitor their health. It is important to attend your visits for the best care while you are on treatment and for a short period after treatment. The treatment you will be having is both ribavirin tablets and pegylated interferon injections. You usually need to take ribavirin tablets twice a day, 12 hours apart, though this should be taken as prescribed by your doctor. It is important to take the tablets with food to improve the absorption.
There are 2 different types of pegylated interferon.
We provide all the treatment and you will be shown by the clinic nurse how to inject this yourself. In special cases, your family doctor may do this for you, but mostly you will do it for yourself. The easiest places to inject are in the abdomen and on the tops of the thighs. The injection sites may become red and sensitive, so vary the injection site. You will take an interferon injection once a week. Interferon must be kept cold, so it needs to be kept in the fridge. When you travel, keep it cold using ice packs. It's really important that you discard your needles in a special container for the protection of others. Make sure the lid is always closed and that children cannot reach it. Never dispose of the sharps in the household garbage. Everyone is different and will experience different side effects and to different degrees. You need to have appropriate counselling before the treatment about the potential side effects. We encourage that any support people attend any appointments with you. It makes it easier for you and your partner or carer if everyone understands the disease and treatment plan. Let's take a look now at how you can help manage some of the side effects we've mentioned earlier. You may get flu-like symptoms in the first few weeks of your treatment. You will be assessed in the clinic and may be advised to use paracetamol, for example Panadol. You should consult your doctor about the dose that is recommended for you to take to reduce these side effects and drink plenty of water. These symptoms usually subside after a few weeks. For fatigue or tiredness, you can save energy by asking friends or family to help whenever you are tired. Also, think about ways to conserve energy in daily activities such as showering in the part of the day when you are least tired or having your groceries delivered instead of carrying them. Rest when you are tired and don't push yourself. It is thought that interferon may increase your metabolism, which can lead to weight loss and loss of appetite. Speak to a dietitian for further advice and monitoring. If you feel sick or nauseous, avoid greasy or heavy meals. Eat small meals more frequently. If you get diarrhea, drink plenty of fluids, avoid caffeinated drinks, and avoid high fibre foods that may make it worse. If you are a diabetic, you may have trouble managing blood glucose levels due to changes in your diet or metabolism. These should be closely monitored and you may need to be referred to a specialist or diabetic clinic if necessary. You may get some redness or soreness at the injection sites. Tell the clinic about these as you may need further education on injection technique. Vary the injection site so you can avoid infection. Skin conditions may range from dry skin to serious skin conditions. All skin conditions will be reviewed on an ongoing basis and you may require referral to a dermatologist. It is best to use soap-free product in the shower and after showering like Sorbeline. In more complicated conditions, you may be treated with topical or oral steroids. In extreme cases, we may cease treatment. Hair loss occurs in approximately 10% of people due to interferon. It does not usually cause baldness, but more likely hair thinning, which usually resolves after treatment is complete. You may experience changes to how you feel and behave caused by the interferon. This side effect can vary. Some people suffer with anxiety, irritability, aggression and depression.
So what's been happening for you since I saw you last month?
Not too bad. I've got lots of support at home with my husband. He's been great. He's really understanding.
So that's been helpful?
Yeah, I'm very lucky to have his support during the treatment. He's really understanding.
You will be closely monitored throughout treatment. It is important to communicate about how you feel, and if you are unable to manage your feelings, you will be advised to seek urgent treatment. Antidepressants may be used and counselling will also be considered.
Throughout treatment, you will have regular blood tests so that we can monitor the effects of your medication.
So what are you testing for in the blood?
Well, it's a combination of things we'll be looking at. They tell us how the medication is affecting you. We will test your neutrophils, the blood cells which fight infection, blood platelets which affect the clotting of your blood, hemoglobin or red blood cells, and thyroid function.
Sleep problems are a side effect of interferon and we will help with this. You will be monitored so you don't lose too much sleep and alternatives are discussed with the treating doctor. Reduced sexual drive may occur and needs to be discussed with your partner so they can be supportive. This is a normal side effect of interferon. It is helpful to discuss this with your nurse, doctor or counsellor if it becomes problematic. It is important before beginning treatment to be counselled about the implications and consequences of pregnancy. Monthly beta-HCG or pregnancy tests will be conducted on all females within childbearing age that are on treatment and pre-treatment. This will be discussed at each visit. Because ribavirin can cause serious birth defects, it should not be used by pregnant women. It should also not be used by males whose partner is pregnant or who may get a woman pregnant, as this may lead to birth defects. Pregnancy is to be avoided during therapy and for 6 months after the completion of treatment. As no one form of contraception is 100% effective, both men and women being treated must always use a minimum of 2 medically effective forms of contraception. Hepatitis C affects the liver, and while alcohol will not directly interact with interferon or ribavirin, it will increase liver damage. Drinking alcohol while on treatment will be like driving with the accelerator and the brake on at the same time. You go at a slower pace. To help speed you to recovery and protect you from more liver damage, your doctor will advise on the amount of alcohol allowed while on treatment. Ultimately, it is best not to drink alcohol at all. Some research has linked tobacco smoking to increased liver damage. While it is difficult to make recommendations based on one study, it is best to quit or cut back as much as you can. If there are drug and alcohol or mental health concerns, one of the team can arrange for you to see someone to help you deal with those issues before you begin and during treatment. Many treatment centres have a team of specialists who treat people with hepatitis C, bringing a range of expertise and services. In order to understand your life situation better, the social worker will discuss with you your general circumstances, such as your work, your family situation, and whether you have supportive people in your life who can help you through treatment.
Tell me about your job. How do you find your work situation is fitting in with the treatment?
Because I've got weekends off, I take Interferon on a Friday night, so it doesn't affect my work too much.
Before you begin treatment, we will talk about your drug and alcohol history and mental health history and how these relate to your treatment. If there are current drug and alcohol or mental health concerns, I can arrange for you to see someone to help you deal with those concerns before you begin and during treatment. So I want to draw your attention to this resource. What I suggest is that at home you go through especially this section. Due to the side effects of the medication, the length of time the treatment takes, and the uncertainty of the outcome, it's important that your life be as stable as possible. You will get the opportunity to discuss any concerns that you may have, and you are also encouraged to bring your partner or main support person along where possible to establish an open and comfortable relationship. I will see you regularly throughout the course of your treatment. I'm also happy to see you anytime between the set appointments if you have a need for individual or couple counselling, or if you just need a safe space to talk about your experiences. Where possible, I will try to match your social work appointments on the same days that you have appointments with a doctor or nurse to minimise your visits to the hospital.
Is there anything here that you can recommend that I take that would help with nausea?
Sometimes cold foods help to reduce the nausea. You may get more success eating cold foods, such as yogurt, a juice, or even a special supplement can replace a meal.
Yep.
A dietitian's role with those undergoing hepatitis C treatment varies depending on the side effects a person may be experiencing. Effects such as nausea, loss of appetite, fatigue and shortness of breath may all influence what and how much is eaten during the treatment. The dietitian will assess those patients who are experiencing difficulties maintaining a quality diet and a healthy weight. Some strategies that may be suggested include eating small amounts often, eating most when you feel hungry, choosing nutrition-dense foods so you can meet your needs with less food, trying different flavours to stimulate your appetite, and even trying ginger products for nausea. Dietitians can also provide advice on special nutritional supplements if you are losing too much weight. A dietitian will continue to provide support as needed, even if hepatitis treatment stops.
Hello, I'm a consultant psychiatrist. I run an outpatient psychiatric clinic at the Hepatitis C clinic. People who suffer from hepatitis C might have a lowering of their mood. Sometimes the treatment of hepatitis C itself might cause depression. Very rarely the treatment is associated with a psychotic illness. My role is to assess patients who have been previously assessed as needing psychiatric input. I then treat them for psychiatric symptoms during the hepatitis C treatment and for a short period thereafter.
Thanks, Louise. We trust that the presentation has been useful in helping you understand more about hepatitis C so that you can prepare yourself for treatment.
Remember, treatment is not easy, but you don't have to go through all of this on your own. We're here to help you, and good luck in your journey.